Good evening, everyone. From Melbourne, Australia. My name is Rachel Ung. I am the Marketing Manager at the Monash Faculty of Pharmacy and Pharmaceutical Sciences. And tonight we're really lucky to be joined by Dr. Tony Hughes, who is the course director of a couple of our master's programs, and also Farah Taresh, who is a current Master of Pharmaceutical Science student. So tonight, we're going to be taking you through graduate study options at our faculty. Before we make a formal start, I would like to make an acknowledgement of country. I would like to encourage everybody to just take a moment to think about the traditional owners of the lands on which you are all situated tonight. I am coming to you from the Monash Parkville campus, the lands of the Wurundjeri people of the Kulin Nations. I pay my respects to all Indigenous peoples, to their elders, past, present, and emerging, and anybody on the call today who identifies as Indigenous. Okay, so how tonight is going to work. Basically, I'm going to start off. I'm going to give you a bit of a faculty overview, and then I'm going to roll into a little bit of detail about pharmacy as a profession and the graduate entry pharmacy program. Then I'm going to hand over to Tony and Farah as well, who are going to take you through the Master of Pharmaceutical Science. And Tony will also talk to you about a really exciting new master's coursework program for 2026, the Master of Global Medicines Development. I'll come back in after that and talk you through our research graduate programs, the doctoral program, but also the MPhil, and then we'll have plenty of time for questions at the end. If you have any questions throughout our presentation, we will save them for the end, but feel free to put them in the chat as they sort of come to you in your mind. I hope that all sounds okay. So let's get started with a faculty overview. So hopefully you guys have done some research about us and know that at the Monash Faculty of Pharmacy and Pharmaceutical Science, we teach into the two disciplines that definitely have their similarities, but also their distinct differences as well. So medicines are the essence of our field, and that is what we will train you in becoming a medicines expert, but in a slightly different way depending on which course you choose. So starting with pharmacy, we like to say that if you become a pharmacist, you are training to become a health professional who is the medicines expert on the healthcare team. Pharmacists work directly with patients and also with other healthcare team members, instructing them on how to take medicines safely and correctly. This is really important because medication mismanagement can cause illness, even death sometimes, as well as a lot of monetary loss to health systems and economies. So pharmacists have a really important role in teaching us how to take medicine safely and correctly. On the other side of the coin, we have pharmaceutical science and pharmaceutical scientists. We say that they make the medicines. Pharmaceutical scientists advance the science of new and existing medicines and respond to new and emerging disease. And we now know, all having experienced a global pandemic, that new diseases can indeed emerge and old diseases can evolve as well. So pharmaceutical scientists also have a really important role in safeguarding the healthcare of societies and treating new and emerging disease. Okay, just some facts about our faculty now. So hopefully you know a little bit about Monash University. We're currently ranked number 36 in the world. There are a lot of universities out there, so that is quite an impressive ranking. And in subject discipline rankings, our faculty ranks particularly highly as well. So we're currently number 4 in the world for pharmacy and pharmacology, according to the QS World Rankings by subject. I think it's only Harvard, Oxford, and University College London that rank higher. We've been in the top 5 for pharmacy and pharmacology worldwide for the last 9 years as well. So that consistency really sort of is testament to the quality of our education and research. And as well as our education programs, we are also home to the Monash Institute of Pharmaceutical Sciences, which is a really globally renowned research institute that provides end-to-end drug discovery and delivery research and services. Now, you are hopefully aware that we are located in Melbourne, in Victoria, in Australia, one of the world's most livable cities, and a city that is particularly set up to students and international students, which is really amazing for our kind of city community. And in Melbourne, we are located in the suburb of Parkville. Parkville lives up to its name. There's lots of green trees and parks around, and it's also very close to the Melbourne Central Business District. We are a very unique faculty because we are a faculty campus, which means that on our campus, which you can see in its entirety on screen here, we only teach the 2 disciplines, pharmacy and pharmaceutical science. We're not the biggest campus in the world, I'll tell you that, but we are a very, very strong community. And I would hazard a guess that we are probably, just one of the, we are like one of the strongest communities of students and teachers and researchers in the world dedicated to the pursuit of furthering pharmacy and pharmaceutical sciences. A little bit about our student experience. So I've already mentioned we're near Melbourne's Central Business District, which is really handy for our students and our staff community in terms of getting to campus because we're highly accessible by public transport. There's also lots of student accommodation close by for those of you who are intending to move to Melbourne, either from other places in Australia or internationally. We take our transition to our faculty really seriously. As a postgraduate student, you will have already completed a degree, but you can probably expect your experience coming to study with us to be a little bit different. We will give you a peer mentor from day one. We make orientation for our courses compulsory, and that's because we really want to set you up for success in your studies by bringing you into our community from the earliest possible time, really. As soon as you kind of enroll, we will be contacting you, linking you with staff and other students in your programs. Okay, so fast facts done. I want to move on to the courses now because we do have quite a lot to cover tonight. So starting with pharmacy and our graduate entry program, I just want to give a bit of an overview of the pharmacy profession and the landscape of the profession currently. So just as a recap, pharmacy is a health profession and you are training to become a health professional if you undertake our pharmacy course. Pharmacists are the chemists, the medicines experts on the healthcare team, and most health challenges in the world will require some sort of medicine for treatment or cure. And there's so many different types of medicines available. And even sometimes one medicine can come in various forms. As a pharmacist, you learn all about these different types of medicines and how they work safely together in the body. Now, training as a pharmacist will likely see you become a registered pharmacist and work in either a community or a hospital setting at some point in your career, particularly early on in your career. And you do undertake placements as part of our program in both these settings that the faculty will organise for you. However, pharmacists are not just limited to becoming healthcare professionals in that direct sort of sense. They can also work in a variety of settings, places like pharmaceutical companies, government organisations, if you're interested in research, clinical trial companies, aged care homes, pharmacy associations such as regulatory bodies, they all require pharmacy professionals to contribute to the unique work that they are doing. And certainly we really saw post-pandemic a whole wealth of different job opportunities open up for the medicines experts within the healthcare team. And it's a really, really exciting time to become a pharmacist as well. So pharmacy graduate employment is really, really strong for both domestic and international students. And the scope of pharmacy is also expanding, which is really, really exciting. We're currently working at the faculty on a graduate certificate in pharmacist prescribing, meaning that pharmacists will be able to prescribe for 22 healthcare conditions sort of in the next year or two. And this is a really exciting development because it allows pharmacist jobs to not only become sort of more interesting and more varied than they already are, but it also allows them to provide a better level of healthcare to the patients and the communities that they deserve. If you are an international student as well, it might also be worth noting that pharmacy is on the temporary skilled migration list. Okay, so now to our course, Graduate Entry Pharmacy. How does it all work? So our pharmacy program comes in the form of a Bachelor of Pharmacy Honours Master of Pharmacy, and typically it is 5 years in length. However, if you have completed a prior undergraduate science degree with specific units, so you need to meet our prerequisites of chemistry, high-level maths, English, and at least one physiology unit, and also achieve a 70% average across your degree, you could be eligible for a place in graduate entry. This will see your pharmacy study cut down to 3 years, 2 of which are quite intensive and full-time study, years 1 and 2 for you, which is really 3 and 4 of the degree. And the 3rd and final year includes a paid internship. So 3 years, basically you'll register as a pharmacist in just 3 years, including a paid internship, and graduate at the end with 2 degrees, a Bachelor of Pharmacy Honours, Master of Pharmacy. Now, you will have noticed on that previous slide that there were the words summer school printed, bridge to practice 2. I did note that it is quite an intense 3 years, and particularly the first year, as you start the program, is quite intensive. So because we are essentially giving you 2 years credit of our 5-year degree, we do accept that your science knowledge is strong if you get a place, but we do also accept that you need some additional pharmacy context to put that science knowledge in to catch you up with the rest of the cohort. So summer school starts in very early January of any calendar year. So you might be back at school on like the 5th of January when all your other friends are at the beach. We put you through an intensive 6.5-week pharmacy summer school. It's full-time study. You will be sort of required to sort of study full-time. So that's the equivalent of 5 days a week. And we do suggest that if you can, not to work during just this intense period. However, many students still choose to work. This 6.5 weeks of summer school incorporates lectures and face-to-face workshops. It covers key topics that you won't tackle later on in the program. They're catching you up from first and second year. And you will also need to do hurdle assessments to pass summer school and be let into the normal semester. Okay, so that is all I'm going to say about the program. Again, any questions, please put them in the chat. There's also much more information online about how your program will actually look. But happy to answer any questions you have tonight, obviously. Just a note about applications, because this program starts very early in the year, applications do close much earlier than typical Monash application dates. So you can see them on screen there. International students, applications close very early, quite soon, in fact, and domestic students have a slightly longer time. That's just to allow for visa processing and things for international students. If you are a domestic student, you will likely get a CSP place for this program. And the next steps are you'll find out an outcome of your application by about mid-December, including formal information about summer school, what to expect. It's really important you read through all that and then join our full day orientation, which is the 5th of January 2026. Okay, that is grad entry. So, Tony, I'm going to call on you now to talk about pharmaceutical science.
Thanks very much, Rachel. So this is really the other side then of the faculty. Rachel, we've been talking about graduate entry pharmacy, helping to actually come out as a health professional. Pharmaceutical science, where you're going to be the scientist that's involved in the discovery of and development of new medicines. So pharmaceutical science is really about, as Rachel said, advancing the science of new and existing medicines. We spoke about the emergence of new diseases. We have, in any case, a whole range of diseases that aren't well treated, still lack appropriate treatments for those. And so there's lots of continuing research to try and improve treatment of existing diseases, as well as the possibility of emerging health problems. So pharmaceutical scientists then are those people that are really that work across a range of allied industries, not only in the pharmaceutical industry, but beyond. And the knowledge and skills and techniques that they have really end up being very highly transferable. And we see that from the very broad range of jobs that our graduates end up with, either from undergraduate space or, as we'll talk about today, those that have done postgraduate study with us. Go on to the next slide, Rachel. So those career opportunities are listed here. We'll expand a little bit more on this when we get to the Master of Pharmaceutical Science, but in areas with graduates in biomedical research, in academia, obviously in the sort of area of pharmaceuticals, but in regulatory affairs, how medicine use is monitored and regulated. We have quite a considerable proportion of our graduates ending up in skincare and cosmetics areas as well too, and we've got some focus work now in the MPharm side to facilitate that for those students that are interested, and in those other areas as well too. So much as pharmacists, many will end up as working as pharmacists, but they'll work in other areas. For the pharmaceutical scientists, you really have a very broad range of options that are open to you. And we see our graduates with successful careers, beginning very successful careers in a range of areas, including those on the slide there. Next slide, Rachel. So let's move on then to the Master of Pharmaceutical Science. So the MPharm Sci is a coursework master's degree. And the aim of this is to develop graduates that have a really sophisticated knowledge of pharmaceutical science that goes very much beyond what we can teach at undergraduate level. And with that, an advanced skill set. And that both those are set up then to meet the growing needs of the pharmaceutical industry and the related industries with it. So it's really an enabling degree that sets you up for a range of possible outcomes. So the way the course is structured, it's basically a two-year degree. You start with put a lot of work into this. We labelled the parts Part A, B, C, and D. Part A is where we cover the foundations of pharmaceutical science, and this recognises that you will come in with an existing degree where you may not know a lot about pharmaceutical science. So it's very much an onboarding semester for students. We give you a fast track into all the key aspects of pharmaceutical science. In part B, second semester in year one, we look at case studies in pharmaceutical science and very much build it on understanding the narratives and stories that sit behind drug discovery and development. In year two, we move into advanced pharmaceutical science studies, looking at what the state of the art is and moving beyond that, looking at role of AI and other advanced technologies. And all of this then builds then to part D, which is the placement and capstone unit for the degree. And students for this go out and spend 10 weeks in the workplace. And we'll look at that in a moment's time in the sort of places that people end up doing that placement. And what that does is allow students to bring all of the knowledge and skills that they've developed in the previous semesters and bring them into real world practice. And for our students, we've seen and heard now from several years of students running through the degree, how this really does act as a capstone for their experience here. Thanks, Rachel. So we have students working in a range of industries, doing either placement in that industry or working there, taking up employment afterwards. We've had a number of students who've been able to go from placement directly and be offered a job with that placement company, which is always really a very exciting thing. We've had students who have done placement and thought, that's not for me, and have helped to clarify what their movements would be after as well too. So, all the sort of possibilities that happen, but you can see from the companies there, we've got graduates who have had placement and are working across a range of industries that relate to pharmaceutical science, to the development and discovery of new medicines. So our entry requirements for the degree are labelled here, described here. So if you're doing the full 2-year degree, which is what most students would do, you would have either done a Bachelor of Science, a Bachelor of Biomedical Science, or a Bachelor of Engineering honours degree with that entry requirement. We do have a small number of students who are coming in and doing a 1.5-year degree if they've done a Bachelor of Science, a Bachelor of Pharmaceutical Science previously. So a relatively small, down to about 10% of the cohort come in at that area. So the majority of students come in at level 1 there. And if you happen to have done a Bachelor of Pharmaceutical Science degree with honours, there is the possibility of coming in for a 1-year degree. That's really quite a discrete group of people. We have 1 or 2 students only that have entered that. So the majority of students, it's coming in for that 2-year degree, and you get then the full benefit of the 2 years with us. Next slide. Applications for the degree follow so more closely the standard Monash application period. So for semester 1 in 2026, applications for domestic and international students, which are open now, close in 31st of January. For semester 2, if you think you're eligible for semester 2, it closes 30th of June, and you can do all that through the Monash My App portal. We have some international scholarships, which are awarded based on merit, a small number, and a limited number of Commonwealth-supported places for domestic students as well.
Mm-hmm.
Awesome. I think that's a really good point now for us to throw to Farah Tarish, who is completing the first year of her MPharm Sci degree here at Monash. I'll pass over to Farah, who's got a bunch of things that she's going to tell us about her experience so far in the MPharm Sci. Thanks, Farah.
Thank you, Tony. So, hello, everyone. My name is Farah Tarish, and I'm currently studying the Master of Pharmaceutical Science at Monash University in Bankville. So, let's begin with the why I chose the program. So, because I'm very drawn to research, I chose to study Master of Pharmaceutical Science, and I actually wanted to build advanced skills that would allow me to really explore the drug discovery in depth, not just from the textbook, but I really needed to gain hands-on experience. So the reason why I chose Monash and the faculty because of, as Rachel said, the strong reputation in the research and the industry connection. So it would be a great opportunity for me to go as a scientist and prepare for both either academia or industry careers. So the major differences between my program and the undergraduate program is that in the master, it's more focused on the research. So there is a real emphasis on the critical thinking, experimental design, and actually we will apply the knowledge to solve problems. So I feel I'm gaining skills that will help me to contribute meaningfully to the pharmaceutical field. And I will share one highlight from the program. So far, I'm really interested in the lab work. So here we will apply the knowledge we learn in class directly to the real world experiment. So working hands-on in the lab help me to connect theory with practice, whether it's in drug formulation testing. So the experience will build the technical skills that we need and give me the confidence that will make me prepare for either industry or research. Talking about the Bankville community, so the campus is really welcoming and it's really supportive. So you will get to know your peers and your teachers as well. And the environment is really friendly. So I feel it's very inspiring to be in the middle of Melbourne. And it's a very strong hub for both biomedical and pharmaceutical research. My advice for all of the future students who are watching me, whether they are international or domestic, is really to embrace research opportunities and be curious. So the program will give you the chance to advance your skill, but again, you will prepare yourself for an exciting career, whether in either you choose to do industry or research or any of the opportunities that we spoke about. Thank you, and I will hand that to Tony again.
Yeah. Thanks, Farah. It's fantastic to hear from you, and really, really pleasing to hear that you find it a friendly environment to study in. I think it's something that myself and the rest of the faculty really take pride in, is trying to make this an inclusive, a safe, supportive environment so that students can learn as well as possible. I should point out one thing which I didn't bring up in the slides, is that the MPharmSci and the degree I'll talk about in a moment are built on the foundations of active learning. So while you may have done an undergraduate degree where you've sat in lectures and maybe sat an exam at the end, there are no lectures in the MPharmSci. There are no end of semester exams in the degree. Instead, you'll spend a lot of time. We'll be guiding you to do the learning that you need to do yourself, and the assessment that we'll give you will be not a written examination. It will be attempts to be authentic in the assessment. So you'll be writing a report that reflects the sort of report that you might produce in industry. We have oral viva assessments that mimic a student supervisor relationship, or your relationship with your boss, where you're coming in and talking about data or outcomes or potential projects. So assessment very much authentic, learning very active. No end of semester exams, no lectures, but you do end up working hard all semester. And Farah, you can, I know you're working very hard with that.
Yeah, I can. Yeah. Actually, I would encourage students, to be engaged during your master and try your best, and good luck, everyone.
Excellent. That's a great note, I think, to move on to our next slide, Rachel. So that was the MPharmSci, a program we've run now for 4 years, I guess, of running that. In 2026, we're going to be introducing a new postgraduate degree in pharmaceutical science, the Master of Global Medicines Development. This is a partnership between us at Monash University in the faculty and the Eshelman School of Pharmacy at the University of North Carolina in Chapel Hill in the United States. So this is a joint degree between the two universities. Very exciting enterprise for us both. Move on to the next slide. Thanks, Rachel. So Master of Global Medicines Development then is a degree for students who've got a science-based undergraduate background who are looking for career we're thinking in leadership, coordination, administrative roles, but very much in a global context. And as Farah will know, modern pharmaceutical development, drug development is very much a global enterprise. And here we're going to really, in this degree, really focus on that global aspect of it. It's a 1.5-year degree. You'll learn advancements in pharmaceutical science. We'll have a focus on sustainable medicine development, which we will carry over from the Master of Pharmaceutical Science. We'll be looking at global ethics and responsibility in drug development. We've got quite a focus on regulatory science, and you're probably aware current happenings around the world, hearing about responses of FDA in the FDA in the US to government pressure and so on. There's lots to learn and take on board about regulatory science. You'll have specific instruction in global leadership principles, and once again, a semester-long placement. Hopefully, we're planning to give this also very much a global context as well too. So a lot of really exciting things that will happen in this degree. Next slide, Rachel. So our career opportunities, we're speculating at the moment. We haven't had a group of students come through here, but our aim is very much to create graduates who are really globally focused and globally mobile. So the sorts of things that we're looking at as potential careers for graduates of the MGMD in global business development, in regulatory strategy, health policy advising, medication access, supply chains, the other things that are written there, all those things that really focus on the very global nature of modern drug discovery. And we think you will be very well placed for any of a range of those sorts of careers. Some of you may work in Australia, but we'll expect that many of you will also find employment outside of Australia as well too, if indeed that's what you choose to do. So we're hoping for a very globally focused and globally mobile set of graduates from this degree. Thanks, Rachel. So entry requirements for that would be the equivalent of an Australian bachelor's degree, either in pharmaceutical science, in pharmacy, or in science, and that could be in one of the areas of science that relates to that has some connection with pharmaceutical science. It could be the major in pharmacology or physiology or chemistry, in biomedical science, and also in engineering in an appropriate discipline, in pharmaceutical, chemical, or biomedical and materials engineering, for example. And you'll need that credit average. It will be fee places only, but there will be some scholarships available for international students, which we're very excited about. And applications are now open, and you do that also through the My Monash portal for that to assess that.
Okay.
Next slide.
I think you're up, Tony. I think it's my time.
That's the last slide that I have to speak about. So I'm going to pass over to Rachel to take us through our graduate research program. So thanks very much, Rachel.
Excellent. Thank you, Tony, for that. It's a really exciting new degree. Something I will mention is that you will be taught by lecturers from both Monash and from UNC, although the course is wholly based at Monash. So we're flying people in directly from UNC so that you get that dual hemisphere perspective.
Did you want me to add something to that, Rachel? Is that,
yeah, please do.
I guess so. That's the. I guess I neglected to say that. As Rachel said, being a joint degree, you will get a single. When you successfully graduate, you'll receive a single degree certificate with the badges of both Monash University and the University of North Carolina. As Rachel said, you'll be based at Monash. You'll do some online, you'll do some face-to-face study at Monash. You do some online units through University of North Carolina, but there will be staff from UNC who come out and teach units here at Monash as well too, in collaboration with Monash staff. So We think we've got a very international mix of teaching in that way. We'll have real Americans coming and teaching you. And of course, all the wonderfully diverse staff that we have as well here too. So I think it's truly a global degree. And I point out that it's a joint degree, and there are not a large number of truly joint degrees around the world, a number of dual degrees, but the joint degree with a single degree certificate is quite special. Sorry, Rachel, thanks.
No worries. Thank you so much, Tony. Should have put some of that on the slides, but in the interest of time, we kept it brief. Excellent. Well, that is an overview of all our postgraduate coursework programs. Thank you so much, Tony and Farah, for your input into those fantastic presentations. Before we open to questions, I just want to run through the graduate research opportunities at the faculty. So like most other faculties or university schools, we have PhD opportunities for prospective students who have done some research, a significant research component in their undergraduate study. This involves thesis submission within 3 years and 6 months, with up to sort of a 4 years maximum duration for full time. And we also have a Master of Philosophy option, which is a really good pathway into a PhD if, you know, your grades, say, might fall a little bit short, or your research experience falls a little bit short in the first instance. So why consider graduate research with us? Well, as a PhD candidate, you are a really important contributor to research and education at our faculty. And again, we have a really great reputation. We're very highly ranked. We have global networks. PhD students are really integral, I think, to the research output and often to some teaching output of our faculty. And as a PhD student, there is opportunity to do both. So you will obviously be undertaking some research, but you will also have the opportunity to do some paid teaching as, say, like teaching assistant or a sessional. A PhD is also a very sort of different way of studying to undergraduate coursework study and even an honours here. So it's really sort of a different experience of studying again. It's much more independent. You're driving sort of entire sort of pursuit of knowledge yourself. And this comes with you being able to build many new skills and new opportunities. And I think that there are some really fantastic highlights that we offer to our graduate research students. So for example, rotations or placements are available to some, not all students, but for example, if you were to apply to the drug discovery biology theme, the PhD program is actually 4 years and it begins with a 9-month lab rotation, which allows you to experience all the different labs that we have within that theme. Some other themes offer this as well, but with drug discovery biology, it is a mandatory component of the PhD program. Some PhDs are involve internships and industry collaboration. So that means that supervisors, you're sort of co-supervised from both our faculty on the research end and an industry partner. And that brings with it really unique opportunities to kind of see the translation of your research directly as you are doing the research. We also have some really amazing opportunities for international collaboration. Every PhD student is currently given sort of a bit of a stipend to travel and have a conference experience as part of their PhD. We have some organised mentoring programs to upskill our students. There's the opportunity to undertake 3MT at some point in your program as well, which I'm not too sure is a key selling point. It might strike fear in the heart of a prospective student, but really important to learn how to communicate your science research. And we take about 55 new PhD starters a year. So it's a relatively small cohort. And I think, again, being a small cohort and a small faculty, it really does allow you to again, get to know your fellow peers and your supervisors as well. Okay, so what areas can you do a PhD in at our faculty? Well, the Monash Institute of Pharmaceutical Science is represented here in 5 themes, but the Centre for Drug Candidate Optimization does not take PhD students. It's more of a service. So you will be applying to a PhD in either drug discovery biology, medicinal chemistry, drug delivery, disposition, and dynamics. So that's sort of the formulation science side of pharmaceutical science, or the Centre for Medicine Use and Safety. And that centre is more pharmacy focused. We also take a few students each year into pharmacy and pharmaceutical science education PhDs. So that would be where your research involves investigating or creating new knowledge in how best we can teach pharmacy and pharmaceutical science students at university level. Okay, in terms of applications, this is probably the thing to take note of the most because the application process is quite involved. So first of all, you need to check eligibility requirements online and also find a preferred project or supervisor and email that supervisor to start the conversation about applying. So there's a list of projects listed online. They're available projects, obviously, but say you have a particular interest in a particular supervisor's research, if you can demonstrate to them that you'd be a really great addition to their team, they'll probably also consider you for a non-advertised project as well. Now, if you are looking at applying to the DDB theme, there is no requirement to find a supervisor because of the lab rotation model that I just outlined. Now, so once you have completed step 2, whether that is finding a supervisor or deciding you're going to apply to DDB, you will fill out an expression of interest form and you will include the documents on screen. Now, the faculty will then have a look at your application and do a preliminary assessment to ensure you meet this minimum criteria. And if you get a positive result, you will be invited to an interview. Being invited to an interview is a really great sign. It's a strong sign that you are a strong candidate for consideration, and it becomes more a bit about, will you fit into the theme, the lab, the culture here that we have at our faculty. You are interviewed by a panel of members from the theme that you apply to, and not necessarily your supervisor. And then once you are successful at that interview stage, you will be offered a formal invitation to apply. I think I'll leave it there with the PhD information. So the only thing I will say is that minimum requirements are about 80, a WAM of 80 to be considered for our PhD program. That is quite a high WAM. It is competitive. As I said, we only take 55 students a year. But if you want to gain a scholarship, you're looking closer to a WAM of 85. So again, if a PhD is in your sights, please, stay engaged during your undergraduate studies or your master's studies. Okay, so I think with perfect timing, really, 10 minutes to go, I want to say thank you for listening and to open it up to questions for the floor. What I might do is stop the recording though, just so that we can speak freely and easily and the questions won't end up online. But before I stop the recording, I do want to say that more info is available at the QR code shown on screen. And if you are on shore next week, so if you're in Melbourne on Tuesday, the 7th of October, you can come and meet all of us, Tony, Farah, and Megan, at our Parkville campus on the evening of the 7th of October from 4 to 6:30. We'd love to see you to have a personal conversation about your graduate study options with us. We'll feed you a bit of food, we'll take you on a campus tour, and you'll really just get a really strong sense and vibe of who we are at the Monash Faculty of Pharmacy and Pharmaceutical Sciences.